The IRB process today has, to a very large extent, lost the respect of the scientific community. It's even lost the respect of many in the IRB community itself because it's become so focused on regulatory requirements and procedures that it's, I believe, lost its way. It's lost its true underpinnings as a fundamental ethical review, and it's become more of a procedural review. And today, I know from my own research, because I'm still doing research, that hours and hours are literally wasted dealing with minutia that really has no part in the IRB process. And it's unfortunate, and that's one of the driving forces, of course, behind the current push for revisions of the process. I think that we are in a different place today than we were 40 years ago when all of this really started. At that time, we were reeling from one scandal after another. We had not only the horrors of the Second World War, but the abuses that Beecher had written about in his article and others. And so, as many have said before me, the system that we have is fundamentally based in protectionism. And I don't believe that scientists are bad people who want to hurt, the patients and all, that they're dedicated to trying to help. I reject that as a notion. I think that today there's a much greater willingness among physician investigators, and I'm talking primarily about, in this case, the biomedical sciences, although you can translate some of this to the social and behavioral sciences as well. But it seems to me that as we have matured and gained greater knowledge and all this, we should have been working toward improving a system to recognize that and move much more toward a system that's based on professionalism, as we have in every other aspect of medicine, than to continue to rely on a truly regulation-based, compliance-focused, process-oriented activity. That it's not clear to me that it is adding to the process the value that we had hoped that it would.
What would you envision?
I would actually envision an application of the processes that we currently use throughout medicine to support professionalism. In medicine, if one is going to practice in a given specialty, I'm a cardiac anesthesiologist. Before I'm allowed to do anesthesia for people having heart surgery, I'm required to go to college, get into medical school, complete medical school satisfactorily, take my national board examinations, get into an accredited residency program, ultimately do a fellowship. I have to pass additional board examinations, within my specialty, and even after I've met all of those requirements, before I'm allowed to practice, I have to go to my institution and seek privileges in order to do it. What's required of someone who wants to be a clinical investigator? Nothing. Nothing. There's an assumption somehow that even today that people will be able to be a responsible clinical investigator because they went to medical an or whatever reason. It's not fair to say nothing. I mean, today we expect investigators to take an ethics module through the NIH that a layperson can take and become a certified investigator in about 7 minutes. We know that because critics of the process have done that. We now expect people to take the city course, for instance, at most institutions across the country. The CITI program is certainly, it's a good step forward, but I don't think that it goes far enough at all. I think if we truly want to have a professional environment that incorporates the kinds of values that we expect of physicians as professionals and others, then we need to build that into the system. And I mean, it's not going to solve all the problems, but I think that if we were to do that, we would find that it would be much easier to have physician investigators who would take a greater personal responsibility for not just the scientific part of the protocol, but for the ethical dimensions of the protocol as well. I find it almost impossible to believe that we have never required investigators to, until relatively recently, we see it changing now, but over the years we've not required investigators to discuss the ethical dimensions of their work, to discuss the options that they considered in order, when they designed the protocol, in order to address those ethical challenges. Why this model as opposed to another model? Instead of that, we've created a system where the investigator tries to design a protocol that will get through the IRB. I think that's wrong thinking. It's the wrong orientation. And if we can change that, then I think we will, truly move toward a new place that we'll all benefit from.